All right, we're all set.
Okay, Sandy, do we have a lot of people in at this point?
Yep.
Okay. All right. Well, thank you very much for attending our second event on these draconian cuts to U.S. foreign assistance. I want to thank all of you out there who are attending this webinar. Hopefully some of you saw the first one. If you did not, we're going to be posting it on our website, and we'll be doing the same with this webinar as well. I want to thank those who are attending, but I especially want to thank the panelists here. We have folks who are attending from South Africa and from Uganda and from Ghana and from Serbia. And so that means that in terms of time zones, they've agreed to participate in this conversation well into their own evenings. And they're agreeing to do that at a very difficult moment. And so I really want to say thank you in advance to all of you. Our first event was very, I would say, US-centric. It was US-centric in the sense that it focused on US policy and research that is happening in US universities on development outcomes that have been done in conjunction with US development assistance. This webinar is meant to focus on the front lines, i.e. on the sort of the frontline recipients of US foreign assistance. We're going to be doing that across a number of sectors, including health in South Africa, including sort of refugee and displaced populations in East Africa, on universities in Ghana, and on democracy and civil society in Serbia. This is, I think what you folks, we probably have a US-centric audience today. I think it's very important for folks to hear these accounts. Because a lot of what's happening in the news in the US is about what's going on with the Trump administration and what's going on with the State Department and what's going on with USAID. And I think it's important to recognize that that while those impacts are big and are very concerning, obviously, that the much bigger impacts are on the recipients of US foreign assistance. And so I think, again, I just really want to thank the panelists. So I've asked the panelists to sort of introduce themselves as part of the webinar. And the way we're going to proceed here is I'm going to start with Kate, and we're going to have an initial discussion on the impacts of cuts in U.S. Foreign assistance on health in South Africa from both Kate and Salome. So Kate, I'm going to start with you. If you could just introduce yourself, say what it is that you do, what your organization does, and how you've historically interacted with U.S. foreign assistance.
Great, thanks so much. Thanks for having me. So my name is Kate Rees. I'm a public health physician at Inova Health Institute. We're a local South African NGO that's been working with PEPFAR, USAID, along with the South African Department of Health for more than 15 years. So USAID has been funding us to help meet the needs of the HIV epidemic in South Africa, and Inova was actually formed for that purpose. What happens in South Africa is that the majority of the USAID funding for HIV is funneled into services that are embedded within public sector clinics. So there are some standalone clinics for key populations, but for the most part, the money and the funds and the resources goes to public sector clinics. And just as a reminder or information, background information for people, South Africa has about 8 million people living with HIV. And so getting treatment to all of those people is a massive undertaking and really requires kind of an all hands on deck approach.
And how have the cuts impacted both your organization? Well, let's focus first on your organization. How has this impacted you all in terms of your staffing, in terms of the services that you deliver?
So in South Africa, our government pays for about 90% of our antiretrovirals, and the Global Fund pays for the rest of it. USAID and PEPFAR do not pay for our drugs. However, in many, many other countries in sub-Saharan Africa, that is not the case. And these cuts have really impacted their ability to pay for life-saving drugs. So I just wanted to mention that. In South Africa specifically, USAID has funded really critical support in a whole range of areas. Supply chain monitoring and delivery, differentiated services, health information systems, additional health care workers where necessary, and so on. At Inova alone, just one organization out of many, we've lost 3,000 healthcare workers. And that includes community health workers, data capturers, nurses, doctors, and their managers, all people really needed to run efficient health services. So I want to just talk about briefly some of the program areas that have been most impacted. PrEP, so HIV prevention, medication for HIV prevention has been really hard hit, especially areas like demand creation, peer support, community services, all of which are really crucial for delivering adequate, accessible HIV prevention services to populations. So South Africa was also due to start using long-acting PrEP injectables in demonstration projects, which was really exciting, and that has all been stopped. Basically, a lot of this prevention through PrEP has just been immediately cut, which is a really serious blow for prevention in South Africa and for HIV prevention actually globally. The next one is key populations, who are people that are specifically vulnerable to getting HIV, but also have trouble accessing standard health services. So now what's happened is that the funding to their services has been cut off really suddenly, and we're kind of struggling to get them into routine services. How do we get them in? We don't have transfer letters, we haven't planned it, we haven't organized it. There just hasn't been that opportunity. And so there's all these vulnerable people who are really, really important to controlling the epidemic that we need to somehow get into services without funding and without the processes in place. High-risk pregnant and breastfeeding women. So this is really important. There's some clinics that have been serving that population in particular, which have been stopped. This can lead to increased transmission from mothers to babies, but also potentially transmission of drug-resistant virus to babies, which is awful. The last thing I think I want to mention is access to data and data quality. So health information systems and data capturing were heavily supported by USAID, and data visualization, data use, which is so critical to health programs today. And my kind of area, which is implementation science and operational research. So a lot of that knowledge and learning not only has been stopped, but also we've lost because we're unable to take it further. We're unable to publish what has been done. We're unable to share what we've created.
I actually have two quick follow-ups. You said that you all had 3,000 staff that had been eliminated. What is that as a share of your overall staff? And then the sort of beyond your organization question is, if you have any sense, I mean, I know that this has just happened in a sense, but do you have any sense on how this is initially impacting health outcomes? It could be that this kind of evidence isn't going to come in for a bit, but if you have anything to say on that, that'd be useful.
Yeah. So for Inova, it's about 90% of our staff, which is quite unique to our organization. We were the largest USAID-funded partner globally for some time, so it really was a big chunk. You know, what we've seen so far, we've lost a lot of our pathways, obviously, to really understand what's going on the ground with so much of the data affected and also community-led monitoring affected and things like that. So I'll mention some things that I know for sure are happening, but I'm sure there's a lot more, and more gaps, as you said, will become apparent as time goes on. So what we know is that people are already not being tested for HIV, even in hospital settings, because of a lack of counselors. We know that PrEP services in some places, particularly with pregnant and breastfeeding women, have totally ground to a halt. We know that people are being turned away from services due to a lack of documentation of their previous treatment, which has been really challenging to organize because of the timelines of all of this. And we know that there's just been huge frustration, confusion and distress for overburdened healthcare workers. We know that they are now unsupported, where we used to have kind of advanced clinical support that was USAID funded, things like hotlines or doctors, which have now been taken away, and that's really been difficult for nurses on the ground. in terms of indicators, we will start to see that probably in the next month or so.
And do you have any sense of how the South African government is responding? I know I'm going a little bit off script here, but you mentioned a number of areas that have been deeply impacted: HIV prevention, vulnerable populations with limited access to healthcare, high-risk pregnancies, these sorts of things. Has the South African government had time to even begin to formulate some sort of a response in these specific areas?
So not really, as there's a lot of civil society groups and other interested parties who've been calling on government to really do more, to take a more transparent and strategic approach to what is happening right now. We do feel that there has been very little response. It hasn't been communicated well to stakeholders, and we're still looking for more from government in terms of kind of acknowledging that this is a really serious problem and trying to figure out ways to move forward.
Okay. At this point, I'd like to turn to Salome, who's also in South Africa at the Arum Institute. And Salome, if you could, so we just heard a lot about HIV. Maybe we'll turn a little bit to TB. But first, if you could just introduce yourself and give us a sense of what you do and what Arum does, and how Arum has sort of interfaced with U.S. foreign assistance.
And hi, everybody that's on the call tonight. I'm Salome Charalamus. I'm a TB and HIV researcher, and I work for the Arum Institute that's very similar to ANOVA, also a public benefit organization based in South Africa. We've for the last 20 years have also been PEPFAR funded. Have been funded mainly through the CDC route within South Africa, and we have provided support to TB and HIV clinics, giving them and making sure that there's clinical training, monitoring and evaluation is in place, and programs are generally supported. So luckily, we're slightly less impacted than ANOVA for now, although we still don't know the full impact of the USG cuts. One of the reasons is that we started quite early on with a strategy of trying to diversify our funding. So we do have some other funding sources from European Union and Gates Foundation and others. But as I said, we really actually don't know the overall impact of the USG cuts yet. For now, one of our programs, which was funded through USAID, is our Accelerate TB program. And that program was providing support to the national government as well as 8 districts in terms of TB. So we were providing TB technical assistance, as well as had teams on the ground that were doing screening for TB, testing for TB, ensuring those that are found to have TB are put on treatment. We were supporting the drug-resistant TB program, which is a really important program because, as you know, transmission of drug resistance is very, it causes lots of morbidity and mortality, and is very expensive to treat as well. And so the quicker a person is identified and put on treatment, the less likely they are to transmit the TB infection, and also they're more likely to then not succumb to the disease and, to go back to normal living again. And so all of those programs have been impacted. That's in 8 districts in the country. And we know that there's a sister program that was called Accelerate 2 that was also impacted. So most of the TB support that there was for the country has basically been stopped. In addition, there are some research studies that were also funded through USAID, and they've also been terminated. And so those research studies are also now no longer continuing.
You mentioned CDC funding. Is that sort of all steady as she goes, or is that also being impacted, or you're just not sure quite yet?
Yes, so we did receive a stop work order for our CDC funded work as well. And so for about a month or so, our teams were forced to not work, were stayed at home. And then we received a notification that we should start work again. So for now, the CDC funded projects are continuing, but we are also not sure for how long. They have been told that they can continue until September, but we're not sure that that is that might change, as
Yeah.
time goes. Yeah.
Yeah.
But we
So I
are
think-
really holding thumbs that does continue, because it does provide some support to the health facilities that are at least fall within that program, and some key populations, as Kate has already said. They're such an important group because they're at such high risk, but also evidence has shown that if you treat the general population and you don't treat those key populations, that the impact that you can have on reducing TB, HIV transmission is very much reduced. So they're a very important group to keep going on, and we still need to see where that goes.
Mhm. So I think a lot of our listeners may not know all that much about TB. Like, I think we probably have a bunch of US listeners. So could you give folks a sense of the scale of when you say that basically treatment and services bearing on TB have stopped, can you give listeners out there a sense of the scale of that?
Okay, so in South Africa, we have around 240,000 cases of TB a year. At the moment, I said that the support to the TB program has been stopped. The TB program does have, it does also, similar to the HIV program, provide its own drugs within the country. But the services that we were doing over and above the routine TB program was to go out to communities and find the missing TB cases. So we know that there are around 240,000 diagnosed every year, but there are around at one stage 140,000 missing people who had TB but had not yet been diagnosed. And these teams that were going out to communities were going out to try and find those missing people. So people who, for instance, don't really know that they're ill yet, or they haven't got access to care. We know that men are more common, have TB more commonly, and men are just not so good at seeking care. They go to work, come back, they're the breadwinners, and they tend to not go to health facilities. And so the programs that we were working, funded through USAID, were actually going out to communities, to places where men work and so on, and doing testing campaigns there to try and find the missing cases of TB. And then we were going to households of people who already have TB. So because TB transmits within a household, often there will be one person who is diagnosed with TB, but may have 3 or 4 or 5 other people in the household, including children and old people. And often those people don't have ways of getting to the clinics, or are unable to get to clinics. And so what the community teams were doing is going out to these households and making sure that those people were tested, and that if anyone was found to have TB, they were put on treatment. And if they were not found to have TB, they were given what we call TB preventive therapy. So some of those are the programs that were kind of over and above the routine programs, where we're trying to really close the gap that exists in the services. And that's been what's been affected right now. In addition, support to the government, providing technical assistance in terms of drug-resistant TB, clinical support, as well as data management and statistical support, that has also been affected.
So just on this last point that you mentioned, above and beyond, so we've been mostly talking about sort of impact on service delivery, but I'm under the impression that U.S. foreign assistance has also played an important role in health research. So I wonder if you could speak a little bit to the implications of the cuts for health research. And this is sort of a very hard thing to think about, but like, what are the things that we are not going to learn as a result of these cuts?
Yes, I mean, the support to health research over the years has really been tremendous from the US government and people of the US. And that has led to many innovations, which include, in the HIV side, once daily treatments, ways of preventing HIV. And within TB, we've been able to find new diagnostics shorter treatments for TB, shorter treatments for preventing TB. But unfortunately, with research, it's a long process. You know, from the beginning, when someone has the research idea to the end of the research project can be 5 to 7 years. And, you know, if that is cut halfway, then all the costs that have already been incurred are in essence lost. So for instance, if you have a program where you are putting people on a shorter regimen and then you only enroll half of the people that you were supposed to be enrolling, you cannot actually determine the outcome because you haven't reached the right sample size in order to give you enough power to actually be able to determine an outcome. So all of that has gone into that project up to that point is actually lost and wasted. And that is a important part that we would like to emphasize is that, even if you stop a research study 80% of the way, you've actually most of the time ended up losing out all of the investment that has already been made, because if you didn't reach the right sample size, you didn't complete the project, or you didn't complete the follow-up to enable you to determine whether something works or doesn't work, then all that investment is actually lost. And, of course, also if one halts a research study in the middle and people are actually on an investigational product, then there's actually a risk to safety to those individuals who are on that product. So all of those are really important problems that come into play when you kind of halt funding for research. So we are hoping that any of the funds that are stopped for research, or at least those kind of things are considered, and that patients are not left to not be followed up if they're already on an investigational product, or projects that have already, are well underway can be completed and the outcomes can be found out, because that would then, if that doesn't happen, you would then be bringing back the field 5 or 7 years back again if you have to start from scratch. So those are some of the important reasons why it's really important for research funding, at least where it's been committed, to continue. And of course, finding these new tools to improve how we manage these diseases is so important. So, stopping research funding at all is quite problematic.
Yeah,
Yes.
I do want to, and I also want to sort of remind our listeners, some of which who might be interested in foreign assistance primarily as a tool of foreign policy, and like the health learning is not like, it doesn't stop at national borders. So when we don't learn about health outcomes in South Africa, like that means that U.S. health just got dumber. Like those are things like that the health community as a whole is being hurt in terms of its capacity to learn about these diseases and the ways in which they might be addressed. So Salome, thank you so much. I'm going to shift now locations and topics. We're going to move to Stephen Malinga in Uganda, and we're going to shift the focus now to issues of refugees and displacement. But first, Stephen, if you wouldn't mind introducing yourself and just giving listeners a sense of what you and the IRC do in East Africa, and just give a sense of the way in which your work has historically sort of interfaced with U.S. foreign assistance.
Yeah, thank you, Eric. And hi, everyone. My name is Stephen Malinga, and I'm a medical doctor, essentially specialized in public health. I've been in the health sector for 20 odd years or so. Currently, my role is the regional health lead for East Africa with the IRC, and I oversee programs in health, nutrition, water, sanitation, and hygiene. IRC, or International Rescue Committee, essentially supports people who have been affected by conflict and disaster, to help them to survive, recover, and rebuild their lives. So our program areas are mostly in fragile and conflict-affected settings. We work a lot with refugees, internally displaced people, but also host communities that host these refugees. And in East Africa, we have vast programs providing these services, not only in health, but also we have economic recovery and development, education, governance, as well as protection. So we provide those kind of comprehensive services. And the US government has been the largest humanitarian funder in globally, but also in the East African region. And much of IRC work, a good portion of it has been through US government funding. And just to give you a feel of it, in 2024, we had over 3 million consultations, over 150,000 people treated for malnutrition, and just under 1 million who were able to access clean water because of the services that we're able to provide. So essentially, that is a quick brief about IRC and what we do.
And before we move on to the implications for displaced populations, can you give us a sense of what the cuts have meant for IRC in particular?
Yeah, the cuts have really been devastating, not necessarily just for IRC, but for the people who we work for. And this has been very significant in the sense that initially we received stop work orders, and then there were some waivers that came through. But that did not solve the entire problem, because even though we received those waivers for life-saving services, some of those were not covered. And then secondly, even more importantly, is that we're not receiving funding. So that just compromises what you're able to do, because if you're not receiving any funds, then even if there are waivers, then you cannot be able to implement. The other thing is that some areas of our work, like sexual reproductive health, in particular family planning, was affected because we're not able to provide that. And so, that has a negative impact. Also in mental health and psychosocial support services were also negatively impacted by this. And with this, we're likely to see a rise in maternal deaths and unintended pregnancies, particularly in the areas that we work, like I mentioned, which are really fragile settings. And in these kind of settings, many times the only source of these services is basically through this funding that has been curtailed. So that's makes it really hard and very difficult. Yeah.
So, Stephen, I wonder if you could speak specifically to the issue of refugees and IDPs. I think, in the US, there is a lot of politics around issues of migration, and this is oftentimes conflated with refugees. I think people don't understand that there's a significant difference between refugees and migrants. Can you give people a sense of the scale of internally displaced people in East Africa, and a sense of what is the implications of these cuts for those displaced populations?
Yeah, sure. Eric, in East Africa, we have about 25 million people who we call people on the move, and that includes refugees, internally displaced persons, returnees in the region. And these are people who are in areas where there is conflict, resources are very limited, and the situation is tough. If you look at the situation in Sudan, for instance, people are always on the move. The situation is really tough, with not only just trying to get services, but to survive is really tough. You don't have any resources. And in many instances, government services are not available. There are areas which are inaccessible by the government and are controlled by non-state actors. And those are areas where organizations like the IRC play an important role in providing these services. So the cancellation of grants and the stopping of the stop work orders really were negative, in the sense that access to water becomes a problem, and in this region of East Africa, there's a lot of outbreaks. Currently, for instance, we have outbreaks of cholera in Sudan, South Sudan, Ethiopia, and in Uganda. Refugees are some of those who are most affected by some of these. We've also had programs around immunizations which have been halted, both for just basic services, but also cross-border, because as people move around, there are programs which try to track that. But these have been either halted or stopped, and this makes it really difficult. As a result, we are likely to see more outbreaks, epidemics. And in this region, epidemics are fairly common. And so we're only going to see more and more of these. So these are kind of challenges that are faced in the region, and particularly, for refugees and IDPs, it's even more difficult because they're on the move. They don't have resources. They don't have people to lean on, which makes them really vulnerable.
And I think so I think in the US, there's a lot of attention these days to cuts to US aid. And then there've also been cuts to State Department foreign assistance. I think what many people don't realize is that there have also been significant cuts to the UN system. And that has implications, for instance, for UNHCR, which is one of the actors that also is quite active in the space of displaced populations and refugees. Stephen, do you have any sense of anyone stepping in to fill these gaps? Is there any reaction on the part of other private actors or other governments?
Yeah, that's a good question there. And actually, the impact is not just to INGOs, but the UN system. At the moment, it's difficult to tell the extent to which other actors are coming in. We know that we also received news of donors like FCDO cutting back, and a number of European funders have also cut back, which makes the situation really tough. There's been some private funding which is coming to different entities, which is trying to help bridge the gap, but that is going to be really small compared to what the US government was providing. And even before all these stop work orders and halting of funding of USG, the needs out there, the humanitarian needs, were far outstripping the resources that were available. So it's basically trying to patch gaps, but the situation on the ground is really tough. Not only that, it's only worsening because just very recently, like in South Sudan, we had new conflict happening there, and over 60,000 people have been displaced. That's a new need arising in this kind of situation. So yeah, what I would say is that there's some efforts out there, but the needs are really very big.
Stephen, I thank you for attending. I'm gonna shift now to Peter Korte in Ghana. So Peter, I've known you, I don't know, I think we first started working together something like 15 years ago or something like that. And we had a project together as soon as like 2 months ago, as recently as 2 months ago. I wonder if you could just sort of introduce yourself and give a sense of what ISER is, the Institute for Social, Statistical, and Economic Research at the University of Ghana, and how it's and its relationship with U.S. foreign assistance.
Right. So greetings to all your listeners and to you, the panelists. I'm Peter Korte, the professor of economics at the University of Ghana, and I'm also the director of the Institute for Statistical, Social, and Economic Research. We have been around as an institute, as a think tank, since 1962. ISER does a lot of evaluations, consultancy, research, etc. USAID or USAID has been a great partner in the sense that even countrywide, it provides about $150 million to support agriculture, education, health, and governance. There are quite a couple of projects that they support, but mainly in agriculture and then the health sector. So one can mention the farmers that were affected by the dry spell improve healthcare delivery in the northern part of the country, especially where poverty is very rife. They also support cold chain equipment for medicines. USAID supports maternal mortality, newborn and child health care, health access in regions, and also the fisheries sector. In all of this support that they provide, ISA comes in handy in the sense that we do the evaluations. So we get grants from the USAID. We monitor and evaluate all these projects to give them feedback as to what to improve, where there are gaps. And I think it makes the work more effective, and then there's value for money. So far, we have worked with, we received a grant in the past couple of years to undertake some work in land reforms. Then the male evaluations, linked male evaluations, of course, which Eric, you were part of it. We started this collaboration to evaluate projects. We've done about 6 of them so far. We've done youth migration. But the most recent one has been within the health sector, the government to government basis, where we would go to the field and evaluate all the interventions. And then once we provide feedback and it's positive, then USAID would disperse funds to government to ensure that there is value for money, there is accountability and good governance. So far, with the stop work order, this has a lot of this intervention that I mentioned has stalled, especially within the health sector, where HIV, AIDS, where maternal mortality is being supported. These are all things that are affecting poor people, especially within the northern part of the country. And I must say, it's something we have been talking about. The government has been talking about Ghana Beyond Aid, you know, that basically not without aid, but with beyond aid. So basically the idea is gradually reduce your dependence on aid. But little did we think it was going to be this abrupt. I think a gradual phase out, or some notice to phase out rather than the gradual, the immediate phase out of some of these interventions. And it's really hitting hard on very poor people, on their health, on HIV/AIDS testing, on those who are on antiretroviral, and many other areas. For us at ISA, there are some evaluations that we undertake, which we receive grants or receive funds, but this income source is curtailed. There are some staff as well who were working on this, who have to be asked to go home. And I think there could be several impacts if I can come back later and talk about some of this in more detail. But basically, this is what we do, and that's how we interact with USAID.
So, Peter, one of the interesting things about ISER is that it has worked with USAID across many different sectors, and has done impact evaluations and other kinds of evaluations, you know, across a really broad range of programming beyond health, which we've now heard quite a bit about. Can you give us a sense of where you see the starkest impacts, the starkest human impacts? Here, I'm not focused, you know, narrowly on ISER or even the University of Ghana, but on the ground among Ghanaian citizens.
I think agric is one of the key areas. Some of the evaluations we have done has been within the agricultural sector, where they provide support to small-scale farmers. They provide support for outgrower schemes. They provide support for aggregators, etc. And I think all this value chain, cold chain, value chain, etc. And that I think is highly significant, particularly in northern Ghana. We have the highest level of poverty in these areas, and that is where USAID's work is much concentrated. So withdrawing this would actually going to worsen poverty. You have people with multidimensional poverty of over 50% in some districts, in quite a number of about 29 districts that have multidimensional poverty of over 50%. So if already poverty levels are high and you're trying to withdraw all this support to reduce poverty, then that's seriously going to impact on people's livelihood.
And what about ISER itself, and what about the University of Ghana more generally? Where do you know, one of the sort of amazing things about ISER is the way that it engages with, you know, MA students and undergraduate students, and sort of the learning by doing that happens there. And I think a lot of people don't know that USAID has also been involved in sort of supporting higher education in other words, not just impact evaluations, but also supporting higher education. I just want to, can you give us a sense of what the impacts have been on ISSER as an organization and on the University of Ghana more broadly?
Yeah, as far as ISSER is concerned, the evaluations itself have been highly affected. As I mentioned, we do basically about 4 to 5 evaluations for USAID in a year, and that has been kettled. And we engage a lot of people, research assistants. There are some as many as 40, 50 at a go. There are staff who we employ at ISSER who are on contract based on some of these evaluations. And it's sad to say that I had to prepare termination letters for them, some unplanned, and it's quite difficult to look them in the face and ask them to go home. We also, indirectly through our collaborators, there are universities in the US who receive funding through USAID or from US State Department, who collaborate with us to provide research, to even provide scholarships, provide training, to provide faculty visits. Not too long ago, I was in Washington for a workshop. A lot of our collaborators met there to look at agriculture, and all this networking, critical thinking of minds, evaluations, all this is going to go or is gone. Then within the health sector again, we have an institute called Noguchi that does testing of virus, it does vaccines. In fact, during the thick of the COVID, they were there to ramp and test, and they do a lot of vaccines, within the sub-region. They are very well known. Noguchi is going down quite severely because of the step work order. I know other faculties or other units within the university have lost funding and cannot train students. Within the Faculty of Agriculture, there's a PhD program that is supported through some of these USAID grants in agriculture. So the impact is quite severe. And I must say that I wish it has been a phased approach than this abrupt stop. I believe with a phased approach, countries can prepare gradually and then find alternatives.
Yeah. Well, Peter, thank you. I mean, I think people in the US, even if they care about the cuts to USAID and they hear about cuts to USAID staff, they don't necessarily appreciate that most of what USAID does is it contracts out work. And so for every USAID job that has been cut, there are multiples of impacts, including, dozens and dozens of enumerators collecting data at a place like ISSER and the University of Ghana, and people working in the health sectors in the countries that we've been talking about. So Peter, thank you very much. I'm going to shift now to Maya in Serbia. Maya, if you could introduce yourself and your organization, your relationship with USAID, and then we're gonna get a little bit into what has been a very dramatic situation for your organization and how it relates to what's going on at USAID. Thanks for joining us. If you could just introduce yourself.
Thank you, Eric. I just I feel obliged to say at the beginning that I'm sending my heart to the people in Africa and to our colleagues that talked, and I'm always feel a little bit strange comparing, and I just want to ask for the listeners not to compare situation in Serbia and Africa, because it's completely different, and whatever I say, like the focus should be on Africa and what people need there. So basically our organization is 30 years old organization. It actually started during the 90s when it was a war in ex-Yugoslavia. It was anti-war activists who established the support mechanism for the people outside of the capital city. So basically we are working for 30 years. The focus is still the same. It's like activism, it's democracy, and the rule of law. Our connection with the USAID was like a project that should build the resilience of the civil society and should be able to also put some bridges in cooperation with the state. So basically, it's a part of what we are doing. And for Civic Initiative itself, we had just one project at this time who was like 10% of our budget. So basically, not very big and huge connection, and not very big like dependence on the USAID at this moment for our particular organization. And just for people to maybe understand a little bit, Serbia is a country that is under the, I would say, authoritarian rule for a lot of years. Democracy is sliding. We had a huge issue on the shrinking civic space, human rights development, and everything else in the last years. And basically, just to remind the ones who are maybe know the region, but not enough, like the region suffered, and Serbia was responsible for the genocide just 30 years ago. So basically, it's a post-conflict situation, it's authoritarian regime, and it's something that it was not recognized fully, or even recognized even from European delegation to European Commission and US. So basically, we are struggling for a long time as a civil society actors in Serbia, but I think for what I will explain later, it's important for people to understand.
So why don't you give us a sense of what's been happening to your organization just as just over the last month or so?
So basically, a lot of have happened. So it's very hard to actually go by thing by thing. But basically, the biggest problem was that in Serbia, and Serbian authoritarian government was very happy when this decision to stop, not only to stop work order, but actually to criminalize USAID by the new administration. So all the statements from Donald Trump, Elon Musk, Rubio were actually used to compile a full investigation on civil society in Serbia. So basically, they said that because the US administration is saying that there is a lot of criminal and drug trafficking and different kind of things done with the USAID money, they are allowed here to actually investigate the civil society organization. So whoever was having USAID grants. So we are now in the process of criminalization. 4 organizations had these police rights. The president and the government is saying to us that we are organizing the colorful revolution, since the big protests in Serbia are going on since November. So basically, it is a very strange thing to explain, but it's like our government actually understood that being authoritarian and being anti-democratic and close to Russia is pretty good now. They were close to Russia. They were authoritarian before, but now it's more allowed. So basically, I got threats for me and my family. So I was advised, and I had to relocate and to go outside of Serbia for a couple of weeks. There are different arrests happening with the activists. There are different arrests now. We have a couple of young people who are part of this protest in jail. We established in the Civic Initiative. Sorry, I forgot to say the name of organization. In Civic Initiative, this shield that is actually legal aid and help for the protesters. So basically, we had one layer is this funding that my colleagues mentioned, and I would say the funding in Serbia is not the worst thing. It is very badly suffering. Different civil societies organizations are suffering because the cuts, but actually this rhetoric and this possibility of the state to introduce fire law or to actually write and arrest civil society activists is something that is hurting us at this point the most. I'm at the moment investigated by anti-money laundering unit, which was like we had issues with that previously, but actually previously it was like the government had to say that was not by the law, and they stopped. Now they are not saying that. I'm having open investigation against me. So literally in the last month, everybody in civil society, the ones who are dealing with the democracy and human rights and the transparency of the government, organized crime and different kind of things which is connected to the democracy as such are actually not knowing are we going to be arrested tomorrow or not. And this is something that we had a lot of issues, and I'm happy to explain in some other conversations, but this didn't happen to us before the new administration came in power, and it was not only connected to USA, by the wording, I have to say, by the people in power in the US.
So Maya, I just want to make sure I understand this. So the other conversations that we've had so far on this panel, what we've been talking about is the U.S. withdraws foreign assistance. That has an immediate negative impact on the organizations that the folks here represent and on the people that they serve. What you're describing is something, in a sense, beyond that, in the sense that the cut in U.S. foreign assistance and are you saying that the language that the U.S. administration used was actually used by the Serbian authorities to go after civil society?
So not only used, like we are smeared on daily basis in the national TV station by the president, by the individuals in the government, but actually this is the language, which is like smearing campaigns got worse, like it's an everyday issue in all the media in Serbia, which are controlled completely by the government. So basically this is one layer, and the second thing is that like official prosecutor's office is actually just using the language to open the investigation and to come and take all of the data that we have, all of the contacts we have with the citizens on the ground. So really they are trying to use our data to, on one side, push the administration, on the other side to map the people who are against them, and to have actions against the people that we are defending.
Mm-hmm. So could you, I mean, I know that this is an immediate crisis for civil society in Serbia. Is it at all possible to look beyond the immediate term into the medium term and get a sense of what this cut in U.S. foreign assistance and, in a sense, the incentives that it has provided and the space has provided the Serbian government, like where do you see the evolution of human rights going in Serbia over the medium term?
So basically, there is a different kind of organization and different kind of support. So basically, some of the USA funding went to humanitarian issues, some of them went to human rights issue, mostly to, I would say, human rights issue, and there is a huge issue with supporting LGBT rights, minorities' rights, which is very important in a post-conflict society. There is a huge issue in actually being able to work on the daily basis. So a lot of organizations will lose their staff. A lot of organizations will lose the possibility to implement the programs. For example, one of the part of our USAID program was the rapid response fund to the activists who are being arrested or attacked by the government or by right-wing groups. So we are losing this rapid response fund, and we are not able at this point to even react if something is happening. But just for you to understand, like there is two-layer thing that we cannot see it as a separate one. So basically, not only that the organization lost money, which would be one layer of the problem, the second layer that the same organization that lost money are actually now criminalized by the government as somebody who is promoting foreign interest and working up like against the state, and the people from those organizations are actually charged to working against the constitutional order, which is a very huge charge, as you probably know, and it's really blunt, so you cannot defend yourself against that, and there is possibility for the direct direct consequences, and us not being able to be, because we lost USAID, we might be in the next couple of years, if this government stays, which is also very important like development, further development issue. But if this government stay, I think we will become closer to what is going on in Russia and Belarus. So not even a Hungary, because we are already worse than that.
So Maya, thank you for sharing your story. I do want to open things up. We don't have a lot of time left. We've been getting a series of questions from the audience, And I guess I'd like to, a lot of what you've had to say is obviously quite daunting and humanly devastating and very difficult to hear. I guess I want to see if we can't find a silver lining somewhere, in the sense that I think for a long time there have been people who recognize that there have been shortcomings or rooms for reform in the way U.S. does foreign assistance. I think there were actually a lot of people inside USAID and partners of USAID who were working on some of those areas. There are also folks who say, well, what this is going to provide is an opportunity to improve some things, that, for instance, this is going to improve country ownership. Instead of the U.S. coming in with a bunch of ideas about what its priorities are, what its programs are, that this sort of opens up a space, and that governments really have an opportunity to sort of reimagine the future. I'm just going to ask you all, and if you could just keep your answers really brief, do any of you sort of see a silver lining in adjustments and maybe over the medium term where this might be going? And I'll just, feel free to just barge in. You don't need to raise your hand or whatever.
Thanks. I think this is a really interesting question, and I think there's definitely going to be increased ownership from governments around health, around HIV, for sure. I think there's a lot of context around this that I just really think is critical. So, we talk about governments should have been, there's often this kind of thinking of why haven't African countries actually taken ownership of their programs already? Why have we been relying on US assistance? And I just wanted to mention the kind of debt repayments that we are laboring under that are actually more at this point than our public health spending, and kind of how that links to all the centuries of exploitation that Africa has experienced. And just to kind of make sure that people don't see this aid as kind of a handout in a vacuum, just out of pure generosity, and really understand the really complex context that this is all taking place in. But I definitely do think that improved government ownership of health programs can only benefit us, and really focusing on health system strengthening as opposed to kind of individual programs that are kind of prioritized by other nations.
Anyone else?
Yeah, if I may
yeah.
go, Eric.
Okay, Peter, why don't you go ahead first?
Yes, yeah. So I think it sets the agenda for resetting, in the sense that, as I mentioned earlier, the thinking about Ghana beyond aid, African countries thinking about how to reduce their dependence on aid. I think this is about time. It's a real reality call for all of us, and we have to look at domestic resource mobilization. Aid has been a very lazy way of raising revenue, and it's making many African governments very lazy. We also have to look at how efficiently we use resources within the continent. So it's a wake-up call, except to say that it's very drastic. I mean, the way this has been implemented is too drastic, but it's something that will help us in our planning. We should plan with shocks in mind, that anytime you're planning, that in case there's any shortfall, there's any exogenous shock, what do you do? I think that's all a wake-up call for us. And for the US government, I think it's also a means of telling people, hey, let's use resources very well, very judiciously. So an audit of what USAID and other US governments does to ensure that resources are used efficiently is good. Except, again, to my point, that doing this, we have to do it gradually with a human face. I think this process has been too drastic in my view. Thank you.
Yes, not at all with a human face. Okay, so Maya and Stephen, I'm going to let you each just put in a word. We're just about at time. Salome, I guess I'll invite you too if you'd like to add a sentence or two. Maya, why don't you go ahead?
So I think basically what is the most important that we can use this challenge, I would crisis as opportunity to actually rethink what are the issues with the development aid before. So basically what we are doing advocacy earlier is actually that we need less money but more flexible. So basically maybe this is the idea that we need to approach and rethink, because we had a lot of issues with the non-flexibility of the money. Even it was bigger, it was not enough flexible to actually do what we need on the ground. And this is maybe opportunity, if we have less money, just to rethink how we will use less money for better.
Okay, and Stephen?
Yeah, I just want to agree with my colleagues that I think this is an opportunity to rethink, but it's also an opportunity for governments to take up more ownership, and probably my prayer and hope is that we'll see more of that. But it's also an opportunity to look at what other mechanisms are there and to review and kind of change the existing financing mechanisms, which potentially can be a turning point and could be a reflection moment, maybe years to come, which we could see that despite this big negative challenge, there was some good that came out of it. Over.
Salome, you wanna close out for us?
So, Eric, I mean, I think just to agree with all the other speakers that this is a turning point, I think, in history, and will teach us. I think maybe there will be more flexibility, more funders out there, that things won't all be dependent maybe on one or two big sources. But I think also it's a time for everyone to realize the impact of all this aid and how that has been so helpful, and that it does need to continue, and we need to find a way to make it continue, and whether it's new mechanisms, public-private partnerships, as well as other donors, countries coming to the party, and hopefully the US also coming to the party, as time goes. Thanks.
Well, you five, I really want to thank you for joining us. We're out of time. I appreciate you telling your stories and what you're seeing. And I'm sorry about the conditions. My heart and my mind goes out to you. For the folks that are watching, okay, thanks to the people that are out there watching. We are going to do one more event in a month. That's going to be with USAID folks. It's going to be in a month because at that point the USAID folks will formally be former USAID folks, and at that point they will be able to speak their minds. We're going to post a video of this event for folks who would like to disseminate it. I think these stories are important, and we should disseminate them as much as we can. And thanks, everyone.